Have you heard of holistic medicine before?
Oh, that's all I use, frankly. I really believe in holistic medicine and naturopathy. And I discovered this amazing doctor here in San Mateo.
Dr. Laura?
Dr. Laura.
Amazing.
We're gonna go meet her.
Yeah.
She's absolutely unbelievable. I'm sure you guys will be really happy to meet her. This is Nadia Al-Khatib with the Al-Khatib Group.
Desiree Garrido. Let's check it out.
Alright, so we're talking with Dr. Laura at Springtide Natural Health today in San Mateo. Thank you for taking the time. We just have a few questions for you.
Thank you, Nadia.
It's a great office, by the way.
Oh,
it's such a good feeling here.
Thank
Yeah.
you. Thank
Absolutely, we love it. We love it here. So can you tell us a little bit about how you got started in this field of naturopathy?
Sure. So I'm a naturopathic doctor. I'm also an acupuncturist, Chinese medicine practitioner, and I actually started my healing journey when I was working in biotech. So I worked in biotech for about 10 years and decided I needed a career change and found out about naturopathic medicine, and within a year I was going to school for naturopathic medicine and really felt like that was my passion and my life's purpose. So and I've always been a believer in having the body to be able to heal with natural medicines, lifestyle, diet, exercise, all of these things. So it's just a great combination for me.
That's wonderful, and that's what we love about your approach, is that it's holistic. It's not an organ specific or a symptom specific approach. It's holistic, right?
Yes.
That's wonderful.
We approach the whole person. So we look for the cause of the problem and then use the symptoms as a guide to help people get better. So the symptoms it's like solving a mystery or solving a puzzle, basically. Yes.
Yeah, so as an example, if somebody came with a headache, instead of telling them to take Advil or Tylenol, what would you do?
First, we would try to determine when their headaches are occurring, if it's associated with monthly or daily routine. We might look into their food, because sometimes food can cause headaches. Also look at sinuses. So we would investigate all of these different avenues to really get to the cause of the problem. And then for headaches, I actually really like using acupuncture because I've had folks in the office. In fact, last month I had a patient that was here and she looked not well. And she said, oh, I have a headache. And we were doing a face-to-face visit. And I said, are you okay if I put needles in you? And she said, yes. And within 5 or 10 minutes, her headache was gone.
So what do you think the root cause for something like this?
That was probably associated more with menses, with her period, and stress. She has a lot of stress, but the way, sometimes with headaches, there can be a blockage in the flow of qi. And so then the acupuncture can help to resolve that.
Oh, that's great.
I mean, that's a simple treatment, but sometimes it's I've had folks that have headaches and it's related to food, especially gluten sensitivity, which is common. Yes.
Oh, that's great. So acupuncture is one of the services that you offer. What other services do you offer?
So my focus for the patients that come into me, I focus on folks that have joint pain. So I actually do joint injections with prolotherapy. So it's using dextrose, and then I often add ozone into the injection to help heal the joint. And so I might do trigger point or muscle injections, so that's really helpful. And then the other folks that I see are folks that have digestive issues, hormone imbalances, so maybe thyroid, adrenal, sex hormone imbalances. And so the treatments that I use then will just depend on what's going on. So I do a lot of IV therapy, so using nutrients in the IV to help people get better, especially for digestive issues. It's really great because you get a lot of the nutrients all into the bloodstream, so your body can use that and it can give the digestive tract a break, and then you start feeling better, healing. I also do nutrients, herbs, vitamins, minerals, and supplements like that.
Oh, Oh, that's
as well as,
wonderful.
of course, diet and lifestyle
That's
changes.
great. That's great. Yeah.
Who's an ideal, like if someone hasn't tried, you know, I would say naturopathic medicine, what would you say they can, you know, just to kind of bring them kind of across the way to you, right? Some people might have a little bit like, oh, I don't know about that.
Sure.
What are your thoughts to help encourage like opening up the conversation or even experiment? I mean, maybe not experimenting with, but trying something different out.
I'd say probably one of the biggest differences between myself and an allopathic doctor is that as naturopathic doctors, we're really trained to take the time and listen to the patients, and I think that's probably one of the biggest differences, that patients come to me and they say, you know, you listen to me and you're trying to figure out what exactly is going on. And then beyond that, if they haven't been to a naturopathic doctor, listening is big, and then we work maybe on dietary things. You know, we meet the patient where they are, and so maybe we start with some lifestyle changes. So if you're not sleeping through the night, then we're going to investigate, okay, how's your bedroom? Is it too hot? Is it dark? You know, do you sleep with somebody that's snoring all night? You know, we look at all of these different factors and then try to determine what's going on and to figure out really the cause of the problem, rather than just like giving some medication or even an herbal supplement and masking it, or just treating that symptom, because I mean, we can very easily do that as well, but we always like to figure out the cause.
Wow, that's so cool.
Definitely,
You're like
that's
Dr. House,
fantastic.
basically.
Yeah.
Looking for the root cause,
That's right.
solving the mysteries of the symptoms. I love that. That's very cool. And so I see you see kids, you see adults. Are they mainly local patients?
Sure. The majority of my patient population are women, which is not surprising, because women are the ones that tend to take care of themselves. And then I do have a handful of men, and probably the age range is, I would say, mid-20s up into 70s, and I even have some folks that are, actually I have a patient, she's in her 90s.
Wow.
So just, you know, the full range. I do see children. It's more usually like if their parent comes in and then, you know, they're wanting support.
Yeah,
so,
of course.
There are doctors that treat pediatrics more specifically.
Yeah.
So I will see children, and then we'll decide if it's the right. But,
And I hear that a lot of people now are doing regular IV therapy sessions just as a preventative measure everybody's getting sick with the flu, everybody's tired, everybody's having GI issues. So I hear that a lot of people are just doing this on a regular basis. Is that something that they could do here?
Yes, and you can do that. And I often require a basic blood panel within a period of time before doing that. But yes, it's definitely something to do. It's a great treatment. In fact, I have some patients that come in, especially like during the cold and flu season, and come in monthly, or if they get a cold or flu, they'll come in a little bit more and get an IV treatment to help.
To recover faster.
To recover faster, and or prevention. Yes.
Love that.
So
that's great. We need to get started on that.
Definitely.
Yep, absolutely. We're in. Sign us up. For sure. For sure. Well, great. Thank you for that. This was absolutely wonderful, and I think you have a little surprise for our viewers.
I do. So if you give the office a call, I am offering a free 15-minute consult, so you can talk with me and we can determine if it's the right choice for you.
Wonderful. So call
I
Dr.
would
Laura.
call right away. I'm calling. Well, we're going to talk after this. I'm right here.
All right. Well, thank you so much for taking the time.
Thank you, Nadia. Thank you, Desiree.
Thank you.
Wasn't that great meeting Dr. Laura?
It was wonderful. It was great. Well, as always, please feel free to reach out with your real estate needs to the Alcatine Group.
Happy to help at any time.
Yes, and wishing you great health.